You promised to rebuild 5 hospitals by 2030 because they're full of this particular kind of concrete that will make them now fall down. Some of the other hospitals that you promised to rebuild are now going to be delayed. So what about the other 29 that the NHS has already identified as liable to collapse?
Well, we were clear in our manifesto we were going to build 40 new hospitals, and the statement on Thursday made clear that that's exactly what we're going to do. But of course, what NHS leaders have said to us is those 5 RAC hospitals, as you say, the ones with concrete where there is a risk to the building fabric, it's right that we prioritise those. So, of course, we're following the evidence, and the evidence shows that those 5 hospitals are priority cases. It's right we respond to those. The ones that are then impacted by that are still part of the new hospitals programme. It's just they may not be completed by 2030, which is the original target date we set in the manifesto. So we're committed to those hospitals. They're still part of the programme. We'll be working on them and starting enabling works on those schemes. But it's right we prioritise the RAC hospitals because there's an urgent need to do so.
So to be clear, and there's no shame in this, you are not going to fulfil your 2019 manifesto pledge of 40 new hospitals by 2030?
We are going to.
By 2030?
We are going to fulfil it by 2030. That's what we were very clear. 5 hospitals are coming into that scheme, which will be completed, and I'll tell you how. It's by embracing modern methods of construction in a similar way to the way that we have in education, in the Ministry of Justice with prisons, as is common in the private sector. So building much more in factories, using modern methods of construction, that speeds up both the approval of those schemes, but also the construction time of those schemes. So we're bringing those into the programme.
I get all that. You can do new things. I started life as an engineer, so I knew things move on. But just to be clear, I thought you just said that you would not be able to build those 29 other new hospitals to get your target to 40 by 2030. Will there be 40 new hospitals by 2030 or not?
There will be 40 hospitals by 2030.
40 new hospitals.
20 of the schemes in the programme will start construction next year. A number already have.
And will they be completed by 2030?
The commitment is for 40 new hospitals by 2030. We're bringing in the RAC hospitals within the scheme because independent reports
RAC being the type of concrete involved.
Bury St Edmunds, they're urgent and we need to address those.
So just to be clear, all 40 are going to be spanking new hospitals open for business by 2030.
There'll be 40 new hospitals in line with the announcement in 2020 where there was a number of cohorts 2, 3 and 4. The cohort 1 schemes were already underway. Those schemes will now proceed. The cohort 2 schemes, for example,
You're not quite telling me that they'll be ready by 2030.
Well, I think I'm being clear. There will be 40 schemes complete by 2030. They will include the 5 RAC hospitals. There were some within the list that will be part of a rolling programme that will go beyond, but that's because 5 have been added to the 40.
All right, we could go on about chop the words for all morning, but let's not
quite a bit of detail in that statement if it's helpful.
Indeed, indeed. So the problem with this pledge is that you did say you'd build this 40 new hospitals. You're now telling me it's going to happen. You originally said that there'd be 8 of them built by 2025. So far, you've managed 2. It's not that persuasive that you're going to build the 40 by 2030, given that you haven't even got the 8 by 2025.
It's a very fair challenge, and let me explain why we're changing our approach as a result. 9 of the last 10 hospitals built in England were over time and over budget. And that's because what quite often happens is as the schemes start, the specifications are changed. People come along with their bells and whistles and want to change what's in the scheme. By taking more time and having a standardised approach, what's called the Model 2.0 hospital, so a standardised approach that allows us to bring all that expertise into one design, then go out to market and have the economies of scale that the NHS office. And this is something that's very common in the private sector. We've already done it in education and in prisons. It is a fundamentally different approach for how the NHS will build its buildings, but that's how we will accelerate the programme, by using modern methods of construction.
OK, we will revisit this, or somebody who's sitting here will revisit this with you in a year's time. Now, at the RCN annual conference, Pat Cullen, General Secretary, said that you'd emailed her and agreed to meet. How did that meeting go?
We had a very constructive meeting this week, working with Pat. Pat obviously was deeply involved in the original negotiation. She recommended that deal to her own members. She said that it constituted real progress.
Yeah, they said no, though.
Well, she negotiated the deal with me and the rest of the Staff Council. She said it was real progress, tangible way forward.
Yeah, never mind what she said. Her members said they didn't like it. They want more than 10%. Are you going to give it to them?
Well, the NHS Staff Council agreed to the deal. So the majority of health unions accepted the AFC deal. That's why that will go into pay packets in June, because we hugely value the work that NHS staff do. That's why we made the offer of 5% plus.
Yeah, but she's coming back for more. She said there's going to be more strikes. This morning, are you saying to Pat Cullen, doors open, we're going to move towards your target, more than 10%? Or are you saying to her, look, you know, the Staff Council decided this, you're getting the money, that's it, forget it?
I'm saying what Pat herself said, which was it's fair and final. Well,
I'm asking you what you're saying.
Yes, and I'm being consistent. And what Pat said at the time that the deal went to members was exactly the same as what I said and what the rest of the NHS Staff Council said, which was as a fair and final settlement, a 5% pay increase plus a lump sum. It means a Band 6 entry nurse gets over £5,000 over the 2 years, recognising the huge, valuable contribution that NHS staff have made. Okay. Now, what some in the RCN are asking us to do isn't legally possible. It's not possible to give a Band 6 nurse a different pay to a Band 6 midwife or a Band 6 paramedic, because their grades that are rated, their jobs that are evaluated in the same way. But Pat herself said this was real progress. She recommended the deal. Indeed, she negotiated.
We all know what Pat said, but what matters is what her members said. And they said they do not like the deal that you've negotiated that has been accepted by the Staff Council. They are a big union. And
it's about a third. It's only about a third. It's a very narrow vote, and it's a small number. Whatever
Pat may or may not have said to you in your meeting, the point is her members don't like it. And what you're telling me, and I'm tell me I'm wrong. The words I've picked out of your answer there are full and final. What you're saying to them is that's your lot.
Well, we're going to make that payment in June to all. Over 1 million.
No, you've told me that, but
staff.
This is you're not going back to the negotiating table with the RCN.
Well, not on the amount of pay. There's things in the deal that we agreed with the NHS Staff Council where there is further work around pay progression, around violence against staff, around pension abatement. There's various things within the deal, and we've agreed a package of work with the NHS Staff Council to take those forward. But this is something that the Staff Council as a whole voted on. Unions like Unison, over 70% supported this deal, and we will get this payment out to people in their June settlements.
OK. One of the other things in that discussion with the nurses is the long-delayed workforce plan, which you promised in November 2018. Any chance we're ever going to see that?
Well, the Chancellor committed to the long-term workforce plan in the autumn statement. It is a big, complex set of proposals. It's right that we take our time to get the detail of that right. We will bring that out soon, but it needs to...
Hang on. When is soon? 4.5 years is not soon.
Well, it was announced in the autumn statement that we were bringing this forward. Obviously, we've had
in November 2018.
We've had a pandemic and various things that have been happening in recent years, but the autumn statement gave a commitment from the Chancellor to have a long-term workforce plan. It's something that colleagues in NHS England have been working intensely on. We need to look at both the additional numbers and how we grow our domestic workforce, but also what reforms we can put in terms of using our skills mix better, using new roles within the NHS in different ways. So it is a complex piece of work. It's right we take our time to get it as it should be, but we will bring that out very soon.
I respect your answer, but when you say take your time, you've already taken 4.5 years. The Chancellor's committed, OK, fine. Is the Chancellor committed to paying the money that any workforce plan, let's go into the detail, but it's going to cost you money, has he committed to paying for it?
Well, of course, any expansion of domestic workforce will come at a cost. There's a cost in terms of the training itself. There's cost from higher numbers in terms of the pay for those roles as well. But it's also about looking at what reforms we can bring forward as part of that plan. But, of course, these are discussions we have on a cross-government basis, and that will be part of the announcement.
Health Secretary, I can sort of hear a sound there, and it feels like the sound that I associate with cans being kicked down the road again.
Now, I've been very clear the plan will come out very shortly. It will be shortly. I'm not going to announce a specific date. Well, yeah,
before the next election?
Absolutely, very shortly. But I'm not going to give a date this morning. A huge amount of work has gone into this, and you know, it's something that we're having discussions on as we speak. OK,
the Chancellor has appeared in our conversation already this morning. He said to my colleague Ed Conway, Sky's data and economics editor, on Friday, when Ed asked him if he was comfortable with Bank of England doing whatever it takes to bring down inflation, even if it precipitates a recession, Jeremy Hunt said, yes, because the inflation is a source of instability. There's nothing automatic about bringing down inflation. It's a big task, but we must deliver it, and we will. Your last job, I think, was in the Treasury. Recession is a price worth paying. You OK with that?
Well, we've been clear. The Prime Minister's 5 key commitments includes growing the economy, and I was very pleased to see that the IMF rated our growth, 0.7% increase. So we do need to halve inflation. We need to grow the economy, and we need to reduce debt. And that is why those are the first 3 key commitments from the Prime Minister in terms of his 5 pledges.
Even if it means a recession with attendant levels of unemployment, impact on living standards, and indeed, by the way, impact on public spending, which means you probably won't get the money that you want from the Treasury. That's all fine or acceptable if it brings down inflation. No, if it brings down inflation.
What I'm saying is we need to grow the economy. That's the second of the Prime Minister's commitments, and the IMF said that the Chancellor had acted decisively. That was reflected in the uprating of our growth forecast from the IMF just this week. So growing the economy is one of the Prime Minister's 5 pledges. We're committed to doing so, just as we are to cutting waiting times. And my focus in terms of the Health Secretary, through announcements this week, like on patient choice, empowering patients, the Patients Association saying that could take 3 months off people's waiting times. That's what we're focusing as
we got a glimpse of honesty from the Chancellor. Mr Sunak's pledge 1, bring down inflation, pledge 2, raise growth. Sometimes those 2 things are going to be in conflict, and the Chancellor's been very honest. He says inflation is number 1 target for a reason, and if that means, you know, that we have a recession, so be it. Doesn't want it, but it might be. Why can't you say the same? Well, do you disagree with him,
you started the interview talking about the cost of the new hospitals programme, and clearly one of the areas where inflation has an impact is on construction costs, building materials, double-digit increase at the moment. So the impact on inflation is important to the NHS. But what we have seen from the Prime Minister and from the Chancellor is their commitment to funding the NHS. 6.6 billion contributed at the autumn statement additionally to the NHS. And most importantly, up to 7.5 billion for adult social care, because how we integrate health and social care is hugely important. So the priority at the autumn statement was health and social care funding, and we have that commitment from the Chancellor.
Let's just get to the nub of what the difficulty is here. All this means borrowing, and the cost of borrowing is climbing. We had a look at the bond yields And here we can see it. Look, you're up to 4.3% now, which, if I read it rightly, this is the highest April figure for borrowing costs since 1997. You are not going to be able to afford any of this because of the borrowing costs, are you?
Well, as I say, the IMF commented this week that the Chancellor has acted decisively.
Don't appeal to the IMF, because every time they say that you're in trouble, you say what a load of rubbish they are. Let's just deal with what you think.
Usually you quote them in the interviews that we do. So,
I'm not quoting them.
So I've just responded to that.
I didn't quote them. These are your numbers.
But my focus as Health Secretary is to get the waiting times down, and that is what we're doing. If you look at the contrast between our approach in England, which is working, where 2-year waits were eliminated virtually in the summer, 18-month waits down below 11,000. If you look at the contrast with Wales, where in Wales it was 74,000 for 18 waits, 18-month waits. So that's what we're focusing on. The Chancellor obviously is looking at the economic side, but what we're doing on the health side is getting our waiting times down.
But the point is, you were responsible at one point for this role, and you know, with borrowing costs at that level, the Chancellor cannot do all the things that you've just been talking about.
Well, that's why the Prime Minister set out the 5 pledges he has in terms of halving inflation, growing the economy, reducing debt. But the fourth one is the one that
core inflation went up.
The fourth one is the one that
core inflation went up from, I think, 6.2% to 6.8%, which is why you've got those interest rates climbing.
Well, CPI has come down, and it's good to see that coming down. So inflation has come down, but we need to go further. But my focus as Health Secretary is on the fourth pledge, cutting waiting times. And just look at the contrast between England and Wales. On 2 years' waits, on 18-month waits. Well, Wales, with a much smaller population, has around 74,000 patients waiting more than 18 months. We got that down to below 11,000 at the end of March.
And I won't say it for you, Wales has got a Labour government on. Here, you say you want to cut waiting times. One of the ways you're going to cut waiting times is by having more people in hospitals, more doctors and nurses, because that's a control factor. Suella Braverman wants to reduce the number of people coming into the country. Let's just first ask you this. Do you think that people who voted Brexit understood that when you said take back control, that meant controlling immigration to the highest net number in our history, 606,000 this week?
Well, as a Brexiteer, when people talked about taking back control, it was about the ability to decide who we bring in and what works best for our economy. And that's why we are expanding the medical workforce. More than 5,000 doctors compared
on the doorstep. They weren't saying that. They were saying to control in order to bring it down, not to get to 606,000.
It was to things like stop the small boats and the illegal migration.
No. We're talking legal migration. 606,000.
But on doctors, you're right, we do need more doctors and nurses in our hospitals. That's why we've got over 5,000 more doctors, over 11,000 more nurses than this time last year. So we are increasing our workforce. Now, part of the...
So when you say that to the Home Secretary, she says, oh, absolutely, Stephen, absolutely, I completely agree. What we need to do is to make sure that even though I'm going to bring the numbers down to, she said last year, less than 100,000, we're going to make sure we have more doctors.
Well, the Home Secretary is absolutely right on the need to bring the numbers down, and the Prime Minister reaffirmed his commitment to bringing the overall numbers down. I think there's a distinction to draw between, for example, some of the abuse of student routes, people coming in on a student visa and then changing, looking at the number of dependents, and we announced this week a tightening of controls, particularly where people are coming on undergraduate student courses and dependents are coming as well. So there's areas. Of course, the numbers have spiked because of Ukraine and Hong Kong, more than 100,000 from Ukraine.
Yeah, come on.
Over 50. And I think that's something most people actually welcome and accept.
Come on.
So there has been...
Come on.
Well, the ONS... No, the ONS
you're one of the few
themselves.
politicians that I know can actually add up. You can do maths. You reduce the numbers from 600,000 to below 100,000. It's 500,000 people out of the immigration figures. Where are your doctors and nurses going to come from?
Well,
if you're stopping 500,000 people.
we're confusing...
You're not getting more doctors and nurses, are you?
I think we're confusing two different things. So firstly...
No, 600,000 legal migration, which includes your doctors and nurses.
I think, as the ONS themselves said, there was a spike because of Ukraine and Hong Kong, which I think most viewers accept was the responsible thing for the UK to do.
When you strip out the, I think it's about 320,000 Ukrainians and Hong Kongers, you've still got more than 400,000 or 500,000.
Well, which is why on Tuesday the Home Secretary announced a tightening of the rules, particularly around dependence of students, looking at some of the enforcement around student moves. So there's things there. I think in terms of the medical community and the NHS, it's two things. We do need international recruitment. That is something that the NHS has always relied on. But we also need to grow our domestic supply. And that's what the long-term workforce plan, which quite rightly you highlighted earlier, is about growing our domestic supply.
All right, look, before I let you go, I'm sorry to say this, but there's one person who never seem to get out of the news, and that is your former Prime Minister, Boris Johnson. Is it all over for him? He says that the claims that are being made about yet new issues for him are all nonsense. He's got to hand over, the Cabinet Office has to hand over the unredacted WhatsApp messages from him to the COVID inquiry, and he's now got himself a new legal team. So it's all a terrible mess. But is Boris Johnson toast now?
No, I think Boris has a huge role to play. We saw his leadership in the country's response to Ukraine, where he took the lead on that. I think that...
Yeah, but we saw a lot of other things. But I just want to talk to you about where Boris Johnson is now. Do you want him back in the next Parliament?
Of course I want all my colleagues back in the next Parliament.
Do you want Boris Johnson to be back as MP for Uxbridge with all the distraction? We're talking about him now.
Of course I want to see Boris back as a Member of Parliament, and I want to see all my
back in the Cabinet, maybe?
Back. Well, the Cabinet's for the Prime Minister. That's above my pay grade. But the point is, Boris achieved many things. The speed of the COVID rollout, look at our response in Ukraine. If I take my announcement this week, the new hospitals programme, the 40 new hospitals, was something he has championed, including for Hillingdon, in his own constituency. So there's many things that I've worked with Boris on.
So you're signing up to the Bring Back Boris campaign, are you?
You're trying to characterise things in different ways. What I'm saying is, within the health sphere, what I am focused on is empowering patients more. That's why we made the announcement this week on patient choice, but also getting that investment into the NHS estate. And we also had the 40 new hospitals announcement, which is the biggest investment of capital in our NHS hospital estate, over £20 billion.
Steve Barclay, thank you very much indeed.